Okay, so welcome to this webinar about the new normal and trying to wade our way through it and accessing care. My name is Nicole Christensen. I'm the CEO of Care Answered and the author of From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. And I am joined with members of the Care Answered family that are just fabulous, fabulous people, as well as really professional and experts in what they do. And I'm going to introduce Sue just before she speaks, but I do want to share with you that Sherry Cohen, the pharmacist who is going to be here and talk to you about accessing pharmaceuticals during this crazy time. Unfortunately, she is ill, so she won't be able to make the call. She is certainly one of our essential workers as being a pharmacist in Nassau County. And I spoke to her last week and she wasn't feeling great, having flu-like symptoms. So I do ask that we all keep her in our thoughts and prayers, that she may have a very speedy recovery. But she does send her well wishes to all of you as well. This meeting, let me just do a little housekeeping. This meeting will be about 45 minutes long. And if you have any questions or you want to make a remark, certainly use that the Zoom chat. If you go into participants that you'll likely see on the bottom of your screen, you can use all those fun features like raise your hand, say yes or no. I don't know what I can do about going faster, but I can try to go slower if you see the buttons there. So those are there too. So you can utilize any of those to get our attention. We will leave some time to ask questions. I will leave some time after I finish talking about each segment, and so we'll do the same, as well as we'll have a little time for questions at the end. So all that being said, I hope you're comfortable. I put on makeup for you today. And I'm really glad that you're here. So let me start with some of the things that I've talked about so frequently that have now changed. So if you've spoken with me or read my book, you're already aware that about the stays in hospitals and rehab and those kinds of things. But let me just go over what used to be and what is the new normal during this time. So first I'm going to talk about Medicare and hospital stays, right? So, and rehab stays. So generally before this, you would have to have 3 inpatient admission stays in a hospital before Medicare would cover skilled nursing facility, right? For rehab and that kind of thing. So now you don't necessarily need 3 in-person inpatient stays at a hospital. Because of all of the delays, evacuations, emergencies that are happening, people may be eligible to get it fully covered, their skilled nursing facility under Medicare, without an actual 3-day stay in a hospital. Okay, does everybody understand that part? Okay. Again, feel free to put chat questions there. I'm looking at my chat screen just in case. So in addition, there used to be up to 100-day stay limitation through Medicare. So the first 20 days would be covered 100%. And if you had a supplemental plan, the 21st to the 100th day would be 80% covered. And then 100-day would be the limit for as far as Medicare would cover, even with a supplement. Now, again, because of these potential evacuations, delay in care, delay in starting of care, delay in ending of care, anything in between that, even if the person doesn't themselves, just like the hospital stay, it doesn't mean that the patient themselves has COVID-19. It's the atmosphere around them and the emergency of around them that has caused these things to happen. It still assists if the person does have COVID-19, but I'm just making sure that we're all clear that the patient doesn't have to themselves have COVID-19 to get more than the 100 days. So their care generally would have been is affected by this emergency. So therefore, it can be that they can get over 100 days. In addition to that, am I losing anybody? Has everybody got me? In addition to that, generally, even to take advantage of those days in a skilled nursing care facility, there would be 60 days in between the last time you used a hospital, right? For that next skilled nursing facility need. So that has also been potentially eliminated because of all of the emergencies, evacuations, delays that have occurred because of COVID-19. So kind of that has been not completely wiped away, but recognize that you can advocate for more than 100 days if the care has been affected by the emergency of COVID-19, okay? Now, I'm going to get to the new normal as far as community Medicaid. Now, there are changes coming down the pike for community Medicaid in general. That's not what I'm going to discuss, but I can certainly put you in touch with my experts in the field, whether they be elder law attorneys or Medicaid specialists that can walk you through that. I'm talking about what's happening right now as far as COVID-19 is concerned. So those that were receiving or that were trying in the process of determining community Medicaid eligibility. So I'm talking about after the person is deemed financially eligible for community Medicaid. Then comes the medically eligible for community Medicaid. So in general, it would work like this. The Maximus you have the conflict-free evaluation nurse come in to the home or to the skilled facility and do an evaluation that would take up to 3 hours. Then hopefully at that point, you would be deemed medically eligible for community Medicaid. Then you would select a managed long-term care provider. Their nurse would come in and again do another up to 3 hour evaluation, and they could potentially tell you how many hours of care that you would receive. Now, in this climate, they are not doing any of the in-person evaluations for reasons of safety for not only the Medicaid participant, but the workers as well and the families of both. So I had sent out information saying that the next conflict-free evaluation could be scheduled starting April 15th. That has changed since last week. So to update you, you can start scheduling the conflict-free evaluation now. And it'll be first available just like it used to be, except it will be telephonically. As far as I'm aware, they're only using telephone. They're not using technology like we're using right now. So that being said, that's a kind of a good thing, right? So you can start the process earlier. The things that I want people to prepare for is it's only telephonically. So what you say, how you say it to portray the real need of your loved one or yourself is vitally important. And I'm not telling you this in a self-serving way. The reality is that people are going to need an advocate more than ever because, again, they can't actually see the person. They're only going by documents and what the person, the potential Medicaid recipient, and their loved ones say. I did ask and find out that they do teleconference. I have done this already for managed long-term care providers in their evaluation, so they do teleconference. The other thing that I want to point out as far as preparedness is that we all need, this is for everybody, we all need our healthcare proxy done in this time because we're all patients at this moment in time. So making sure that you have that done, but for the community Medicaid, it's going to be even more essential because again, they are only doing it telephonically right now, as far as I'm aware, which means they don't know who is the healthcare proxy unless they're given some sort of information saying so. So make sure that that is done. Also, if your loved one or the person that you're working with is not able to say, yes, these people can be on the phone, right? When this would not be the case generally. If it's not on the phone, they can just nod their head or the healthcare proxy is there. Just be sure, again, that the healthcare proxy is in place so that you can speak for them as they wished. And that you have it. I don't know how they're getting the actual healthcare proxies, how they're doing that to make sure that they have it in place. But I do know that it behooves all of us to make sure it is in place and that we have access to it. Okay? Are there any questions about that? One of the other things is that the managed long-term care provider, again, the second evaluation or third evaluation, however you look at it, they also are doing it telephonically. Again, I'm not aware of any of them utilizing technology such as this to do face-to-face, like a telemed yet. So again, those are just important things to note. Last on community Medicaid is that those that are already on community Medicaid, those periodic reassessments have been suspended, completely suspended for the time being, for the uncertain future. So if you were thinking, oh goodness, they're gonna come again or they're gonna call me again for the reassessment and do that evaluation, that's not happening. It has been suspended until further notice, okay? However, if you feel like you need a reassessment because there has been a change in health or a decline in health in which you need more care, you need to contact them about that because that's a different matter. I just know that the policy says that on their end, it's suspended for just the general reassessments. Okay? Okay. So with all that fun, I'm going to now talk about telehealth. So telemedicine, telehealth has been around for a long time, however, not widely utilized. There are many reasons for that. Wasn't widely utilized by practitioners nor patients, but now it's a new day and we're in an emergency atmosphere and it's being made available. So the first suggestion that I really have for anyone and everyone is that you contact, while hopefully very healthy, you contact your clinicians now to see if I need to see you, if I need care, how do we do it? How is their office dealing with care and visits at this moment? So make sure that you know that for your clinicians. Many of them are kind of coming up to speed now, I think, with the telehealth, and they're trying to get that information out, but be proactive and find out yourself, and then make those appointments if necessary. Obviously, if it's not a necessary visit, you can talk to your doctor about it, but what I'm seeing is those are being postponed till later if it's not a necessary visit. But again, make sure you know how it's being done within your clinician's offices. Another thing to keep in mind is a lot of people take medications, right, that they can only receive if they've had a visit with their doctor, even if it's a renewing medication. So a lot of the doctors have now in place these telemedicine calls, conferences, virtual visits, so that you don't have to wait for that. So you don't have to worry, oh my goodness, I'm never going to be able to see my doctor at this time, but I need my medication. You can make a visit for that and it will oftentimes be utilized and thought of as a visit, and you can pick up your, then they'll send your medications or your prescriptions to the pharmacy of your choice. Okay? So don't think that that prevents you from getting your medicine. Most of the doctors that I've spoken to and seen have that in place so that people aren't going without. Okay? But I will say on the prescription, don't wait till the last minute, because nobody knows what tomorrow brings. But if you know you have that medication and you needed to check in with that doctor before, don't wait till, the day that you would need to see them. See if you can schedule it now to make sure that it's at the pharmacy at the right time. Just don't take any chances, please. Tell your loved ones as well, and anybody you're working with, don't take chances. Get it done. Be prepared so that you can get all the medications that you need in a timely fashion rather than after you need it. I have heard of some prescriptions being more difficult to get, meaning they may take longer to get. I'm not saying that they're out of them. I'm not saying run everywhere to go get it. But I have seen, even personally, the prescriptions for like what's in a nebulizer and inhalers, that kind of thing. Their pharmacies are giving updates to, order now. Again, I haven't been told that it's not available. It's just don't wait till the last minute type of things is what I've been hearing. All right. Okay. So I know that was a mouthful and I probably spoke way too quickly, but please let me know. Does anybody have any questions? You can put it in the chat. Wow. Awesome. Okay, well, if you think of them, please feel free to put it in any time. And hopefully, I'm going to just describe where everything is, just in case. Again, I'm assuming it's the same place on everybody's screen, so excuse me if it's not. But if you put your mouse down to the lower part of the screen, you'll see things like participants, share screen, and chat. In that chat is where you can ask any of the questions that you might want. Okay? And there's also reactions. Oh, that's just clapping and thumbs up. Okay, so without further ado, I'm going to introduce Susan Null, partner at Systematic, and they do medical billing advocacy. Again, she is a wonderful person and also just an expert in her field, and gets to the heart of the matter and gets things done, solves the problem. So I'm so excited to have you here, Sue, and take it away.
Thank you, Nicole. I appreciate that. I appreciate being invited to talk with everyone about what's going on in our healthcare environment right now that we're all learning on a daily basis. And what you mentioned at the start of things changing daily, with what we do, it changes hourly in some instances, and it's a work in progress. So we all continue to learn, but in the last few weeks, there's a lot that's come and gelled together that is helpful information, I think, for everyone as it relates to their financial responsibility for their healthcare. As I said, outside of the crisis, when it comes to your healthcare, you must have conversations with your insurance carrier directly regarding your policy, because Blue Cross and Cigna, United Healthcare, and Oxford, and all of them have thousands of different policies, and they cover things in thousands of different ways. So just because one Blue Cross policy covers something doesn't mean that another does. And you have to make sure that you have those conversations to know specifically what your policy is going to cover. So with this particular health crisis going on, the first thing I say that you do as it relates to understanding what your responsibilities are as it relates to billing is call your insurance company and find out right from the start, does my policy cover telemedicine visits? And from there, begin the conversation to find out, what does that exactly mean? Is it telemedicine in general, regardless of what the reason is that I'm going to have the need to see my doctor, whatever that diagnosis might be? or is it only specific to COVID-19? Because it will make a difference. And we are seeing it already making a difference in how claims are processed. And even if they tell you that it is covered, just because it's covered doesn't mean that you don't have to pay something. So you need to fully understand cost sharing, which means what is your responsibility for payment on any given claim, separate from what your insurance company is going to pay. And typically those are co-pays, co-insurances, and deductibles. So you want to know from the get-go, because this is going to probably go on for some time, and telemedicine is going to be around going forward. You want to know from the get-go what those parameters are. Once you know those specifics, be certain that you have a technology that you can use to communicate with your physician. As Nicole had mentioned, call your providers up and find out, are they doing this? Are they not? What service are they using? HIPAA guidelines have been relaxed so that services like FaceTiming and Skyping, which were never allowed by HIPAA, are now allowed, because what the community is trying to do is allow people to get the care that they need. So you do need to understand that those conversations might not be as secure and private as they would be in a Doxy.me or a Teladoc or some other service that is fully HIPAA compliant, but it certainly will give you video and audio access to your provider. So you want to make sure that you know what that service is, and that whatever you're using, be it your phone or your computer, that you have the access to use that and you're comfortable using the service to sign up and also access the provider. Once you have all that underway, now it's a matter of, so who's covering what? In terms of Medicare and Medicaid, they're covering the gamut. I should back up again and say, there are lots of different expenses that are a part of this COVID-19 umbrella. There's testing, there's treatment, there's out-of-network care, there's cost sharing. There are all kinds of different elements that are involved in this. So you need to make sure that you understand the nitty-gritty of what your particular needs are. So in terms of Medicare and Medicaid, they're covering testing and virtual visits, regardless of the reason, whether it's COVID-19 or whether it's another reason, at 100% with no cost sharing. And just recently, Medicare is allowing for just telephone visits with your provider. There are also some check-ins that you can do online via portals and things. But from what we're seeing from the doctors, most of them are either doing audio-visual communications or they're doing a telephone call. So for people who are not as technologically comfortable as others, yet need to have the conversation with their provider about something, and you are a Medicare, Medicaid patient, you shouldn't have to worry about cost. There are some commercial carriers who are providing coverage on that as well, but again, you need to call and find out for sure, because there aren't a lot to date. And again, to date is are the operative words here, because once we're done with this, something else could change after we finish with our call today. In terms of commercial carriers, most of them are covering testing without cost sharing, but you have to be very careful where you have that testing done. So some of them are requiring that they're done at hospitals, some of them are requiring at urgent care, some are allowing them at physicians' offices. You need, again, to know what your policy is going to cover to make sure that you don't have financial responsibility for any of those costs. In terms of just virtual visits with your doctor's provider, most are covering without cost sharing any COVID-19 related issue. Some are covering non-COVID related reasons with cost sharing, without cost sharing. And again, as I say, this really is changing on a daily basis. More and more of the companies are coming online, more and more of the policies are coming online to do that. And as I mentioned, a few of them are covering the audio visits, but fewer than actual telemedicine. Some carriers, Oxford and United Healthcare, are actually allowing for out-of-network providers to be covered as in-network for COVID-related diagnoses. But again, you need to be careful about this, because when you're out of network, it means you do not have a contract that provider doesn't have a contract with your insurance company. So what needs to be determined is the allowed amount. The contract would determine the allowed amount. When a contract doesn't exist, there is no allowed amount that's been established. So the insurance company is going to determine what their out-of-network rate is by what Medicare's rates are, percentage above Medicare. It could be usual and customary. It could be an average of what they pay their in-network doctors, a wide variety of formulas that they might use. But the bottom line is where it impacts you is that most likely whatever that reimbursement is going to be less than what your out-of-network doctor is asking you to pay. That's why they're out of network. They don't want to accept the reduced fees that the policies are providing. So what you're going to get is potentially some reimbursement for that visit, but you will be billed by that provider and you will end up probably being balance billed as well. So if the visit were $150 and your insurance company determined that $50 was the allowed amount, you could be billed $100 by your provider. And so you should need to understand that upfront and be very careful about that. One area that is something that people should be aware of is those people who have self-funded plans. These are usually large companies. In fact, most people are covered under self-funded plans. These are large companies, they're unions. They are organizations that actually pay for the healthcare coverage themselves. They hire a Blue Cross and Aetna, United Healthcare, to administer that policy for them, to tell them what they're supposed to pay. But in the end, they're the ones who are writing the checks. They are not held to the ACA guidelines, and they're not held to any of these cost-sharing releases that the fully funded plans are offering. So if you work for a company that works with Blue Cross and it's a self-funded plan, and even though Blue Cross's self-funded plans, Medicare plans, Medicaid plans have all waived all cost sharing for COVID-related diagnoses for telemedicine visits, they're not necessarily releasing them for the self-funded plan. The self-funded plan can opt out of it, and you would need to, again, determine and find out, is your plan covering that or not? So all of this does take some work on your part, but again, it enables you to avoid that surprise bill at the end of the day, and also to know that once you do get an explanation of benefits, has it been processed correctly or not? Again, because things are moving so quickly in what's going on here, a lot of policies have been made by the insurance companies, and they haven't all fully trickled down to the software that actually processes these claims. So whereas an insurer may say, yes, we're opting out, we're getting rid of all cost sharing, it might not have been put into their system yet. And if your claim goes in and that software hasn't been updated, you're going to get a bill for the cost sharing. So that's why the other thing that after you've gotten past all of this is you have to monitor your explanations of benefits. Those papers that come in the mail or those files that you'll see on your portal that will explain to you line by line what your provider billed, what was approved, what was written down, what was put towards a deductible or a copay or coinsurance, and what you should be expected to pay in terms of a bill from the provider. If you find that, if you've done your homework at the start and you know what your policy is and isn't supposed to cover, then you should be able to look at that document and know if it was processed correctly. And if it wasn't processed correctly, then you have to start to take some action. The action may be first with the insurance company to find out why it was processed incorrectly, to determine if it was their error or not. If it's their error, then you can get them to correct their error. But if it wasn't their error and it was a coding error from the provider's perspective, then it's going to be a matter of you're speaking to the provider's billing office and having them submit a corrected claim to the insurance company. So again, you don't want to sit back on this because we don't really know what all these costs are going to be in the end. You want to keep your costs down as low as you possibly can. And so we always recommend that you take the time to do the due diligence by comparing those explanations of benefits against what services you actually provided. And then again, when the bill comes in from the provider, making sure that bill matches up and that charges you no more than what your insurance company said that it should charge. So that's medical billing in the age of COVID-19 in a nutshell, the Evelyn Wood version of it. I'm happy to answer any questions that anyone has now or later. Otherwise, I'll turn it back to Nicole for stage 3 pharmaceuticals.
Thank you, Sue. That was excellent and very thorough. Basically, once you get in the weeds, we're here. Sue's here, Systematics here to assist and advocate with medical billing. So I'm going to speak now a little bit more on the pharmaceuticals and from our friend and colleague, Sherry Cohen's stance on it. Again, as I mentioned, we've worked together, Sherry and I, as well, with different clients on medication advocacy. And she's also very thorough and does a stellar job with it for many of our Care Answered clients. One of the things that she said is, you know, don't go without medications because you're scared. There's a lot of fear, and that's perfectly understandable. And as always, talk to your clinician. But in many cases, going without your medication is more risky than potentially getting your medication when somebody else has touched it. But again, ask your clinician about that. But one of the things that she wanted me to mention is that there are many ways to get your prescriptions. You can use the usual the drive-through window at your pharmacist if they have one, so that they can bring it to you outside and you're not, you know, you're not face to face with anybody, certainly not in a 6-foot distance. And so you can pick it up there. A lot of the pharmacies are doing delivery. Whether you can't make it to the pharmacist or you don't feel comfortable going, you can get a delivery option. And so if you're still concerned, which is totally understandable, that other people have been touching the product, including the pharmacists, etc., wipe down the bag, wipe down the packaging, as many people are doing with regular packages that come to their home. Wipe it down with the alcohol or the Lysol wipes or what have you, just to make sure. And most importantly, as we all have been hearing, and I'm sure hopefully all know and do at this point, is to wash your hands frequently. Once you touch it, you wiped it down, wash your hands again. But we don't want to see people unnecessarily not receiving their medications because they don't feel it's safe to do so, if it's also not safe for them to not have their medications. So she wanted to let you know that, as well as that going into a pharmacy, a lot of them that I've seen, and she was talking about, have something so that it's a 6-foot distance from the cashier to give it to you. So there are a lot of pharmacies putting that into place, keeping up with that 6-foot distance. So know that that is also an option for you. And just stay safe and talk to your clinicians about all of these things to make sure that you're prepared and ready. That's what it's really about. We're trying to put forth, and I know a lot of my colleagues in the field are trying to put forth an effort to bring information so that people can be prepared and not scared, so that they know actions to take that can better assist them and their loved ones. With that being said, I want to ask again if anybody has any questions. I have a few more things to say, but I want to make sure if anybody had any questions regarding pharmaceuticals or medical billing advocacy, a situation that you might have, or concerns. Okay, so far nothing, which is great. We're doing great, Sue. But I do want to let you know that all of those who registered for the call, which is more than that are here, but all of you will get information, bios on Sue if you're not familiar, or me if you're not familiar, as well as tips and guidelines on the various things that we spoke about. I'm sending out telehealth FAQs so that from the Department of Health, and Sue has prepared a wonderful handout about kind of the billing aspect and the measures of advocacy that you could potentially do yourself at the beginning through the process, like she spoke about. So that I hope that will be helpful. And again, a recording of this webinar will also be available. So with that in mind, I think we did well on time. 3:41, did it. So I'll be presenting, Karen Anton will be presenting more webinars in this series of the new normal, hopefully coming as soon as next week. I'll let you know about them. And I thank you so much for joining and for being here and being part of the solution in everything that you do. And I hope that you stay healthy and stay well, and hope to see you out there soon. All right. Take care. Again, unless anybody has any more questions, we'll take off from here. Okay?
Sounds good.
All right. Bye-bye, everyone.
Thanks so much. Bye-bye.